Welcome back to the Drive Time News Hour, KFGO time. We are coming up on 5:15. Love to do this. Usually the second Tuesday of the month going on the Drive Time News. Our chance to catch up with our friends from Eye Consultants of North Dakota, and Dr. Ann Keating is with us again this afternoon. Pleasure to have you back with us, Dr. Keating.
Yes, thank you for having me.
So we talk quite a bit here whenever we have you guys on to talk about, hey, go in and get your eye appointments. You should do it pretty much yearly. Just we think about it with dentists all the time, getting your teeth cleaned and all that, but it really is no different with eyes, is it?
Right. We recommend annual eye exams, especially as you enter your more senior years, to detect early signs of different eye problems that we can help, prevent vision loss.
Well, and not just vision loss, too. I mean, talking to so many eye doctors out there are a lot of other things that you can maybe see that maybe, we talk about checkups with other different types of doctors, your family doctor, whatever, but you guys can sometimes see other things. I mean, obviously diabetes is part of it, and hypertension too, right?
Yes, that's correct. When you come in for an eye exam, we check the front to the back of the eyes, we check the visual acuities, the pressure inside the eyes, and then we do a dilated exam so that we can get a really good look at the back of the eye, which is where we can detect early signs of some of these more systemic diseases, because we get a good look at the retinal blood vessels, which can show signs of high blood pressure. We can see bleeding or hemorrhages, which can be a sign of diabetes. And so it is a kind of a view to the rest of the body when you come in for your eye exam.
It kind of seems like people are taking more notice of this, right? I mean, I think that in the last 5 years or so, people are understanding that you need to go visit your eye doctor, even if you never had glasses your whole life, or if you're not passing. For me, it was the old DOT exam, right? Where you're getting a little bit close, and all of a sudden you go in and try to renew your. I guess are the driver's license bureaus that probably helps you out a little bit, because I know that I was guilty of that when I had to renew my driver's license. I did it a week up because I thought, last time it was pretty close. I better, and sure enough, that's what that made me go get glasses.
Right. Yes, those DOT exams do catch some eye problems, and we do have patients that come in because they didn't pass.
Which also furthermore says, I mean, don't wait till that moment, right? That's why you should have a yearly exam.
Exactly. Yes, after age 40, starting at age 40 and even earlier if you have needed glasses. But if you've never had any problems, then the American Academy of Ophthalmology recommends a screening eye exam at age 40, and then yearly depending on what the findings are.
I think it comes down to, we talk about with so many different things with health, is that it's no different than anything else with blood pressure and, looking to make sure that if you have a family of heart disease, if you have situation with eyes too, I mean, it's about being proactive and not reactive. And I was a little reactive to it, but you can really help yourself out if you are proactive.
Exactly.
When you look at this too, as far as you mentioned, there's always the usual suspects about, like, diabetes and hypertension and a few other things. What are other types of, I guess when it comes to when we get a little bit older, and I'm almost 52 now, what are some other eye diseases or any diseases at all that you can see from your exams of eyes?
We're screening for glaucoma, cataracts, macular degeneration, and even, some cancers that can affect the eyes. Glaucoma is a leading cause of, it's a silent blinding disease. And so that is one that, unless it's detected early, leads to irreversible vision loss. And most people don't notice it in the early stages because there are often no symptoms. You don't have any pain, and your central vision is good. It starts by taking the peripheral vision first, which you often don't realize unless you are in for an exam.
That certainly makes sense too, and I guess that's why, like we said, you got to be proactive of all these things. If people want to get a hold of you and maybe get a type of get ahead of the game, as we mentioned, get your exam ready to go. If you feel like you need glasses or just something's going on, how do people get a hold of you?
You can reach us at Eye Consultants of North Dakota, 701-235-0561.
All right. And, of course, the website, Eye Consultants, very easy Google search, too, eyeconsultantsofnorthdakota.com. Doctor, we thank you so much for being with us, and we will do it again very soon. Can't wait for our conversation again next month.
Yeah, thank you again.
You bet. Dr. Ann Keating with us again. Eye Consultants in North Dakota. Check them out online. And of course, as you mentioned, you can find all the phone information, all that and more right there at your fingertips. This is the Drive Time News. Derek Hanson with you here on the Mighty 790 and 104.7 KFGO. Let's get to Sarah Heinrich and the Ag News.